Okay, so this is our final voice evaluation project. It was completed by Virginia Rodriguez, Bianca Palacios, and me, Tiana Mojica. For our case study, our client's name is Emily Vocasios. She is a 43-year-old female who was referred by her otolaryngologist due to a bilateral phonotromic lesions, which are caused by vocal misuse or overabuse, and a recent vocal fold hemorrhage, which was caused by a recent rise in her vocal use. So she currently lives at home with her husband and 2 children. She uses her voice daily at home and work with her family, customers, and coworkers. She recently enrolled in singing classes that take place once a week about 4 months ago. And about 2 months into her singing classes, she started noticing breaks in her voice, a loss of vocal range, sudden hoarseness, and slight breathiness, along with an uncomfortable feeling in her throat. These episodes would last about 2 to 3 days, and then her voice would return to normal until the vocal hemorrhage last week. She usually engages in vocal warm-ups for her singing classes, but only once a week right before her class. She doesn't practice daily vocal warm-ups or vocal hygiene techniques on a daily basis. So her symptoms have been consistent and get worse throughout the day, especially after smoking. She has no prior history of voice therapy and briefly took singing classes as a child. For her past medical history, she noted that there has been a history of anxiety and depression. She has no surgical history, and she currently takes Prozac for the anxiety and depression. So after interviewing her, we recorded that she drinks about 1 to 3 glasses of water daily, 1 to 3 glasses of coffee daily. She drinks socially, smokes socially, has no reflux history. And as I said, she engages in singing classes once a week now. She completed the Voice Handicap Index 10 with a total raw of 5, which indicates that she has a moderate perceived voice disturbance that impacts aspects of her daily life.
So for the laryngeal examination, a flexible nasolaryngoscopy and stroboscopy was performed by Dr. Rodriguez. I am now going to show you a video of the examination. So for the nasolaryngoscopy, it demonstrated a symmetric abduction and adduction of true vocal folds, a hemorrhagic changes in right vocal fold consistent with vocal fold hemorrhage was noted. A mid-fold small polyp changes was noted and small mid-third fullness on left fold. For the stroboscopy, a mucosal wave and VPD reduced at all fundamental frequency was tested, and an hourglass glottic closure at all fundamental frequency was tested. So the CAPE-V, the Consensus Auditory Perceptual Evaluation of Voice, was administered to assess Ms. Rocasios' voice quality. The results indicated a mild to moderate degree of overall dysphonia, 25 out of 100, characterized by mild roughness, 25 out of 100, mild breathiness, 10 out of 100, and moderate strain, 30 out of 100. Pitch and loudness was judged to be within normal limits based on the client's age and gender, both showing 0 out of 100.
101, so high up there, but not.
Go ahead and read those silly sentences.
Sure. The blue spot is on the key again. How hard did he hit him? We were away a year ago. We eat eggs every Easter. Mama will make lemon muffins. Peter will keep at the peak.
And then hold on to vowel.
Okay, so for the aerodynamic evaluation, we conducted a SZ ratio and a maximum phonation time. For the SZ ratio, Emily demonstrated an S of 9 seconds and C of 6 seconds. That ratio was a 1.5, which demonstrated an elevated ratio compared to the female norms, which are less than 1.4. For maximum phonation time, she demonstrated 7.4 seconds, which is decreased compared to the female norms of greater than 14.3 seconds. An acoustic evaluation was administered. A fundamental frequency speaking was demonstrated of 231.3 hertz, which is within normal limits, and the norms are 180 to 250 hertz. A physiologic range was administered, and it demonstrated 217.2 to 286.0 hertz, which is within normal limits. The female norms are 156 to 787 hertz. For her phonatory range in semitones, she demonstrated a 22 semitones, which is within normal limits. For non-singers, for her average intensity in decibels speaking, she demonstrated 58.9 decibels, which is within normal limits of the female norms, which is 50 to 70 dB. For her minimum intensity, she demonstrated 51.3 decibels, which is elevated from the female norms of 35 to 40 decibels. And then her maximum intensity decibel demonstrated 62.6 decibels, which is decreased compared to the female norms of 80 to 90 decibels.
Okay, so now we're moving on to the stimulability testing. Ms. Ocasio was stimulable for flow phonation and resonant voice exercises. She was aware that her voice improved in clarity following the exercises. The patient demonstrated moderate stimulability with semi-occluded vocal tract exercises, and she also benefited from verbal models, visual, and tactile cues. Impressions and summary. Emily Rocasios, a 43-year-old female, was seen at the Pace University Speech, Language, and Hearing Center for a voice evaluation. She was referred due to a bilateral phonotraumatic lesions caused by poor overall vocal hygiene and a recent vocal fold hemorrhage due to sudden rises in vocal use. Vocal pathology was confirmed after a flexible nasolaryngoscopy with stroboscopy was conducted. Her symptoms include persistent breaks in her voice, a loss of vocal range, sudden hoarseness, and uncomfortable feelings in the throat. The Voice Handicap Index 10 scores indicated that these symptoms have a moderate impact on her daily life, and the CAPE-V results describe her voice as characterized by mild to moderate strain and mild roughness and breathiness. She will likely benefit from vocal hygiene recommendations for hemorrhage resorption. The plans and recommendations. It was recommended that Ms. Rocasios incorporate vocal hygiene techniques while taking vocal rest and follow up with a laryngeal exam to ensure hemorrhage resorption. Voice therapy should be considered a resolution of hemorrhage. The therapy should be designed to improve laryngeal mechanics and prevent further strain leading to repeated hemorrhages. Vocal hygiene recommendations. Avoid using your voice for talking and singing. Drink healthy fluids throughout the day to hydrate and protect the vocal folds. A good amount of liquids to consume is 6 to 8 ounces of water, 6 to 8 times every day. Reduce your intake of drinks that contain alcohol or caffeine, which can cause the body to lose water and make the vocal folds dry. Eliminate smoking to stop irritation of the vocal folds and facilitate lesion recovery. And avoid taking medications that can dry out the vocal folds. For this, you can read the side effects on the medication labels.